Hi, my name is Luke VanderZouwen and I'm a physical therapist at Full Potential Physical Therapy, and I'm here to talk to you today a little bit about the aging process and how physical therapy may be a part of helping as we all go through that aging process. So there are certain changes that happen as we age. Everyone knows this. We have all seen as either maybe relatives have gotten older or we ourselves have gotten older. There are some things that slow down and some things that change with time. So we see that across multiple body systems, including organ systems, musculoskeletal system, and the nervous system. With organ systems, certain organs tend to slow down a little bit. Our metabolism slows. Things like digestion even take a little bit longer. There's a lot of different changes that happen in our organs as we age. Also, nervous system is another system that is affected. So this would be the brain, spinal cord, any of our peripheral nerves, so nerves that run out into the rest of our body. Typically what we see is nerve firing going a little bit slower. Things like memory changes can happen, reaction changes can happen. Then if we move on to the musculoskeletal system, there some of the changes are very obvious. We've all seen people as they get a little bit older, they tend to do things like develop some arthritic change, so that would be oftentimes classified as a degenerative change within our bony system. I like to think of it a little bit different. Our body wrinkles on the outside, and we don't call it degenerative skin disease. Our body wrinkles on the inside too. So we have some of these bony changes that occur. Typically there's less muscle mass. Also tissues that once were more stretchy, think tendons, ligaments, even muscles, tend to be a little bit stiffer as we age, and that just has to do with some things that happen along the aging process with how our body goes through that process. So that's a lot of downers, that there are some of these negative changes that happen with age. However, one of the common denominators for a lot of our different aging processes that occur is movement can be helpful. So I have arrows pointing to movement here from these different systems. So movement can be helpful for a lot of different things. And we all have heard too, exercise is a good thing, but exercise can be helpful for more than just our muscles and for our heart and our lungs, which are very important. It can also be helpful for how some of our organs process. For example, the GI system can be helped with movement and how our bowels function and some of those type of things. And also for our nervous system, if we're practicing movement on a regular basis, it can do things like speed reaction time. It can do things like make some of our sensory perception a little bit more sharp. So movement can be really helpful for the aging process and ensuring that we're aging as well as we can with really good quality of life, which is really what everyone wants. We all know we're going to get older, but it's quality of life as we age that is what people are looking for. Oftentimes though, there are barriers to moving well. Some of the most common barriers that we see in the physical therapy world is pain. So if the body is in pain, sometimes it doesn't want to move. And when that's been going on for long enough, it can start to have some effect on some of these body systems that are affected through the aging process. Other barriers would be lack of strength. It might be balance issues. If people are having issues with balance, they tend not to move near as much, and that can have some other effects on the body. Also, just not knowing what to do. So if you don't know what to do when it comes to a healthy movement practice, you're probably not going to be moving as much. If you're thinking, I want to be able to move better because I want to have a positive impact on my aging process, but I don't know how to do it, or I have some of these barriers that are keeping me from doing it, physical therapy can oftentimes be something to consider. Physical therapists like myself, we're trained in picking up on movement dysfunctions and then coming up with holistic plans to try to improve movement quality in order to eventually improve function, with the idea that that will help with quality of life long-term going forward, even as we age. That can get complex, and sometimes it helps to have someone on your side that you can share some goals with and then establish together a plan to accomplish those goals. So if you're noticing that you have some of these barriers to moving well and you'd like to move better, I highly encourage you, bring up physical therapy with your physician, or call and schedule an appointment with a physical therapist, schedule a consultation with a physical therapist. We'd be happy to do that here at Full Potential. And we can go over some of those goals and some of those issues that you might be having and determine if physical therapy is right for you. Thanks for your time.